It's one of the most persistent challenges in development work. How do you take a program that has been effective in a few communities or at a local region and expand it to a larger area or even to the national level? Paolo Mefalopolous, the UNICEF representative for Uruguay, says that it depends on two main factors: political will and the homogeneity or diversity of the population.
Well, the challenges of scaling up C4D depends really from the context. Now, it's an obvious answer because now I'm working in a country like Uruguay with 3 million people. Before I was in India with 1,200 million people. So it's clear that the issue of scale, it's a major one. But I would say the other major challenges are the political will of a government. Again, if a government has a will to actually introduce these changes, it's much easier. Also, the fact that C4D interventions pay higher return, but in a much longer term. Therefore, both for donors and politicians, an investment in C4D, even though it's more sustainable and it is quite proven that it has a number of benefits in the long term, it takes a lot of time, and sometimes there is no such time, or people are not willing to wait. Therefore, that often becomes a major obstacle towards scaling up. But it's not so much the size per se, which of course is important, but it's much the heterogeneity or homogeneity of a certain population. So in India, certain intervention, you could scale them up within certain states which had similar background, similar ethnic, religion, language. For instance, the Hindi belt zone. Other states with different statistics, different demographics, you couldn't do it. In Uruguay, everything is much more homogeneous, so you can scale up directly to a national level. In India, you couldn't.
For Hedy Ip, a nutrition specialist for UNICEF in Myanmar, the process of scaling up has to be driven by communities. It's simply not enough to train community workers or hire NGOs.
Okay, I think that, when you go really deep into the community level, it's very intensive. You need the time and you need the resources. And if you want to cover national scale, that's really a lot of resources. So I think what needs to be done is to try to see what is a scalable and feasible model to do that in a certain area, and then try to replicate that. And we can't replicate that by hiring our own or, NGOs hiring community workers. I think that we have to just directly talk with the communities and see what are already people or groups or networks existing in the community who can be mobilized to then carry that on, without kind of payment of salaries or linked to a project. But that if you really get the community engaged, that it's something that kind of self-perpetuates itself, and that trying to get communities who have experienced this to go into other communities. I mean, we as partners can facilitate their movement and visits to other areas of the country in which they can again try to share their experiences of how they did it as a community, and then convince other communities to do the same. But I don't think that if we want to scale up in that way, we can't think of it as the classical, typical, NGO or UN project that we've seen in the past, where we sort of train, we hire, we do it here, and then we kind of scale up and do the same thing. I think we should show a model that works with one community, but then get those communities who have gone through that successfully to then go to other places in the country.
In Ethiopia, it's not just differences in language and culture that make scaling up difficult. According to C4D specialist Hanna Woldemeskel, lack of coordination between ministries and among donors leads to uncoordinated efforts and mixed messages.
One of the crucial challenges is the diversity. I mean, there are, in terms of language, in terms of culture, in terms of geographic context. So we have the pastoralist communities, the developing regional states, the developed regions. And the regions are really autonomous in the federal contexts. So what we are trying to do at federal level is about strengthening the guidance that goes down to the regional level, but it gets adapted in terms of the context of the regions. So if we strengthen the ministry's capacity in standardizing messages and harmonizing the efforts of the number of partners, and providing more tools and approaches, and then this will be really adapted at the regional level. So, I mean, we can't really go blanket at community level, but we need to do both. So that's I think the benefit of having our field offices.